Welcome, everyone. It is so wonderful to see so many faces. We have a bunch of people joining us from all over. Thank you for joining our celebration of Assemblymember Richard Gottfried and the New York Health Act. My name is Carlin Cowan, and I am your MC for this evening. It is incredible to see so many faces from all over to celebrate the absolutely incomparable Assemblymember Gottfried. Please go ahead and introduce yourselves in the chat by typing your name, your pronouns, and your location. We have everyone muted so that we can hopefully all hear clearly tonight. And you can open the chat by clicking the chat icon in your Zoom toolbar, which is usually found at the bottom of your screen. We are going to be recording this session tonight and sharing the recording in a follow-up email to everyone who RSVP'd. So if you had a friend that couldn't make it, don't worry, they will be with us in spirit. A couple more logistics and accessibility notes before we dive into the celebration. You can get closed captions in English by clicking the closed captions icon in your Zoom toolbar. Again, that is at the bottom of the screen. And we hope that you will take screenshots and post on social media the things that you learned tonight. Tag the Campaign for New York Health, send your well wishes to our incredible fearless leader, Assemblymember Gottfried, and just generally help us celebrate. All right, so now we are going to begin with a land acknowledgement. We recognize that people are joining this forum from all over, but this is being hosted by the New York Metro chapter of Physicians for a National Health Program, PNHP. So we think it's important to acknowledge the land on which we are based is the traditional and unceded territory of the Wappinger, Munsee Lenape, Canarsie, and Rockaway people. The theft of this land, which is both historical and continuing, along with the stolen blood and work of enslaved Africans, enables our presence here. All institutions, including our healthcare system and the nation state itself, were founded on and continue to enact exclusions and erasures of Indigenous people. This acknowledgement demonstrates a commitment to beginning the process of working to dismantle ongoing practices and legacies of settler colonialism. We pay our respects to Indigenous, African, and immigrant elders past, present, and future who have stewarded this land, and particularly to the hundreds of Indigenous nations who continue to resist, live, and uphold their sacred relations across the lands. This acknowledgement is neither sufficient nor complete, but it must become part of a larger process of learning and action. With that, welcome, everyone. We are so incredibly glad that all of you are here tonight. This is just a small but mighty portion of the entire grassroots movement across the state of New York to pass the New York Health Act. We have been a campaign, the Campaign for New York Health, since 2014. And we have grown so much since then. And all of you here tonight, the work that you have all done is an incredible testament to that growth and that progress that we have made towards guaranteeing healthcare for all New Yorkers. And tonight is just the next step in continuing that fight as we mark some incredibly important celebrations and changes in the campaign and fortify ourselves for the fight ahead of us as we push for healthcare for all New Yorkers. So without further ado, we have a lineup of incredible speakers for you all that we are so glad to share. They are here to celebrate and acknowledge the incredible Assemblymember Gottfried, his decades of leadership, and the progress that we have made in growing the Campaign for New York Health and building our movement for health equity across New York State and across the entire country. Our first speaker of the evening is someone that you likely all know well. He is the lead sponsor of the New York Health Act in the state Senate, Senator Gustavo Rivera, who unfortunately could not join us since he is out of the country, but has recorded a video to share his greetings and well wishes for Assemblymember Gottfried.
Hello everyone, this is State Senator Gustavo Rivera coming to you from very far away. I am currently in a at a public plaza in Lisbon, Portugal, for a prior. I'm here for a conference and taking a little bit of sightseeing today. But I wanted to make sure that even from far away, I took an opportunity to send my greetings and my appreciation to Dick Gottfried. Dick has been an amazing member of the legislature, but I'm glad to say, I'm happy and proud to say that he is a friend, a mentor, somebody who I know that I could not do the job that I do without his leadership and his mentorship. And I'm going to miss him immensely. And I think we're all going to miss him. The reality is that Dick has been at the head of the curve for so long. He's one of those rare folks that can both be someone who has been around for as long as he has and continue to be an effective legislator, somebody who so many of us respect, look to, and follow. So he is, but he has a well-deserved retirement coming up, where he will be doing a lot of writing. He does the thing that does calligraphy, and he's going to be traveling. But Dick, I'm still going to call you. You're still gonna get calls from me. I'm gonna include the Taiwan. When you're in Taiwan, I'm gonna have the time zone here, so I know when I'm back in New York not to bother you too late in the evening. But I will still be calling you for advice this coming legislative season. But bottom line, I am immensely appreciative for everything that you've done for me, sir. But more impressed with the work that you've done for the state of New York, for the people of New York, for so long. Your career in public service will be unmatched. And we are all the better for it. So thank you so much for the work that you continue to have done for so long. We love you. We will miss you. And again, many of us, certainly I speak for myself, will still be calling. So I'm looking forward to hitting you up in retirement, but wish you the absolute best. Take care, my good friend, and I will see you when I get back.
I am sure that Senator Rivera is just one of many people in a long line that will be calling Assemblymember Gottfried for his extensive expertise and wise advice in retirement. But I certainly hope, Assemblymember Gottfried, that you also get time to enjoy said retirement. You are truly a pioneer, and the wealth of knowledge, as Senator Rivera often says, you have forgotten more about healthcare than probably the rest of us on this call combined together know. And we really thank you, as well as Senator Rivera, for working to get to the New York Health Act to where it is. You were able to add long-term care fully included from day one into the bill, reintroduce it several times, secure a majority of co-sponsors in both the Assembly and the Senate. And we are so grateful for the work that you have done. Next up, it's my pleasure to introduce Dr. Oliver Fein, a professor of clinical medicine emeritus at Weill Cornell Medical College, where he practiced general internal medicine and was associate dean for affiliations until his retirement in June of last year. Dr. Fein is also importantly the chair of the New York Metro chapter of Physicians for a National Health Program, PNHP, former president of National PNHP, and former vice president for the United States of American Public Health Association. Dr. Fein, please take it away.
Okay, well, thank you, Carlin, and good evening, everybody. It is a real honor for me as chair of the New York Metro chapter of Physicians for a National Health Program and the former president of PNHP, national organization, to join this celebration of Assemblymember Richard Gottfried. Dick Gottfried has been a leading health advocate, both locally and nationally, for decades. He was elected to the New York State Assembly 52 years ago in 1970 and became chair of the Health Committee in the New York State Assembly in 1987. Some highlights that illustrate the diversity of his legislative work include the law that gives patients access to information about a doctor's background and malpractice record, the HIV testing and confidentiality law, the law to legalize medical marijuana, the Child Health Plus program, which allows low and moderate income parents to get free or low-cost health insurance for their children, and the Family Health Plus Act, which provides free health coverage for low-income adults. One of Dick's most significant contributions, however, is the New York Health Act, which of course is the vital legislation that brings us all together here tonight. Our state-based, single-payer, comprehensive healthcare program covering all residents of New York State and delinking health insurance from employment. Dick first introduced the New York Health Act 31 years ago in 1991, only 2 years after PNHP published its physician proposal for Medicare for All in the New England Journal of Medicine. PNHP has had the pleasure of collaborating with Dick Gottfried and other advocates on the New York Health Act for many years, on essential amendments such as coverage for long-term care, including home-based health care, as well as nursing home care. We have made significant progress in recent years in advancing the New York Health Act. It has passed in the New York State Assembly 5 times, most recently in 2018, with a 2-to-1 majority. With lead sponsor Gustavo Rivera and a Democratic majority in the New York State Senate and Assembly, it has real possibility of passage in the New York legislature. It is our job to get increased grassroots, union, even business support to help drive it forward. Thanks to Dick Gottfried for all that you have done to make healthcare a human right. Everybody in, nobody out. The New York Health Act. Next, we will hear from Dr. Mary Bassett, the 17th Health Commissioner of the New York State Department of Health, and a steadfast advocate for health care for all and health equity, who, I am proud to say, has been on the PNHP New York Metro's advisory board for over a decade. Assemblymember Gottfried and Dr. Bassett, it has been an honor working with you both, and we look forward to collaborating again in the future. Thank you very much.
Thank you, Ali. Hi, Carmen. Should I start talking?
Absolutely, Dr. Bassett,
All right.
take it away.
So I've written out my remarks. So I want to say what a pleasure it is to be among many people I've known and worked with for many years. And let me start by introducing myself. I'm Mary Bassett. I'm the New York State Health Commissioner for another couple of weeks, and I'm truly delighted to join this evening to say a few words of praise of Dick Gottfried. We all know how long and illustrious Dick's legislative career has been. Some of you may be surprised to learn that he was not the first chair of the Assembly Health Committee, but only he remembers the name of the person who was. For me and for many of us this evening, it is his single payer bill, which Dr. Fein has just talked about, the New York Health Act, with which he's most closely associated. And this one, as we all know, has not yet passed. But in case you think that Assemblymember Gottfried managed 52 years in the legislature pursuing a so far unsuccessful bill, I really feel obligated I felt obligated to do a little homework, and I won't enumerate many of the bills that have passed that Dr. Fein has listed, but Dick sponsored one, the Family Healthcare Decisions Act, that took over 15 years to get passed. So we none of us should get tired. So there's been plenty of legislative triumph to offset the peculiar political resistance to getting universal coverage that government coffers already pay for. If our healthcare costs were anything like those in other wealthy countries, I just read the other week that California is now paying more than $10,000 per capita for healthcare. The staggering amount that we pay still leaves some 27 million people uninsured, nearly 1 million of them in this state, New York State. So don't get me going on this topic. When I was the New York City Health Commissioner, Dick used to ask me to all these single payer events and ask me to bring the mayor. And I couldn't get the New York Health Act on Mayor de Blasio's agenda. So I would show up at all these meetings in my personal capacity. As you heard, I've been a longstanding member of PNHP and have long been on the record for my support of single payer government health insurance. So I know that if healthcare costs just keep going up, and if the purpose of these funds is to provide better health to the population, we are just getting a very bad deal. So I couldn't get a green light for memo support for the New York Health Act. But one day, Brian Lair, the radio station in New York that Mayor de Blasio had, I think, a weekly show with. Anyway, he announced that he was a single payer advocate. So we got our memo in either that day or the next. And I have to say, sometimes it happens that our elected officials are more in touch with the public than our bureaucrats. So another reason that I've had such faith in Dick was I somehow got the idea when I first met him that his initial training was in physics. I thought he was a physicist. And I'd heard that the speaker referred to him as Dr. Gottfried. So I probably am not the only one in applying to Assemblymember Gottfried credentials that he's never earned formally. So in my mind, there was this person trained in physics who decided to go into politics when he was practically a child. And when I stopped by his office, I learned that he did calligraphy additionally. So I have a feeling that after life in the Assembly, Dick, you'll have plenty to do. As a lawyer, politician who has defied the laws of physics by serving in the legislature for over 50 years with character and verve, sometimes in Chinese, you will be terribly missed. And we all, if we were in person, I hope would raise a glass in gratitude to you for all these many years. Here's my cup of tea. Congratulations. Well done.
Thank you so much, Commissioner Bassett. Thank you for the incredible work that you have done advancing health equity in New York City and state. And while we will miss you terribly, we are incredibly glad that you will continue contributing to the future education of public health. Thank you for reminding us why the New York Health Act is so important and how far we've come. And without further ado, I'm going to introduce the person that we are all here to celebrate tonight, someone that has served 52 years in the Assembly, an incredible public servant that has authored and sponsored and passed countless of bills to expand the rights of New Yorkers, that has always been on the right side of things, even when it was difficult or unpopular, and later proved that we all should have followed his lead. And one of my healthcare heroes. Without further ado, the man of the hour, Assemblymember Dick Gottfried.
Well, thank you all very much. This has just been wonderful. You know, I don't know where a rumor about me being starting out as a physicist came from. Although my colleague in politics and high school classmate Jerry Nadler did start out planning on going into physics. But you know, I just want to say a few things about you know, our history on this issue and some of the things that people have talked about. You know, I've been going through files in my office, cleaning them out, some to be saved somewhere in some archive, some to be sent to the recycling bin. And it reminded me that in 1971, in my first year in the Assembly, I was at the first press conference by Assemblyman Bill Passananti, introducing the gay rights bill. And I always say that that press conference was so small that we could hold it in the legislative library in the Capitol building and nobody had to come over and tell us to shush. Now, it took about 31, 32 years for that bill to finally become law, but it did. And a year or two after that, we introduced, and I was the first Assembly sponsor of the bill to legalize same-sex marriage in New York. And that took about 8 years to become law. But today, you know, President Biden just signed the Respect for Marriage Act. And, you know, who would have thought just a few years ago that federal legislation recognizing same-sex marriage would not only pass both houses and be signed by a president, but pass both houses with bipartisan support. So ideas mature and have their day. And, you know, I remember in the spring of '91, when people from the New York State Nurses Association and Statewide Senior Action Council and Citizen Action came to my office in Albany and sat me down, and they said, Dick, we have to explain this single payer idea to you, because really this is what you ought to be supporting. And I remember that meeting well. It was like a light bulb going off in my head. And it has been a life-changing moment ever since then. And I have been, you know, maniacally focused on getting single-payer legislation passed in New York. We're not there yet, but we're going to get there. And while in 2 or 3 weeks I will become a retired public employee, I certainly intend to continue working on advocacy for the New York Health Act. And the group that has worked for it, and many of you are on the Zoom meeting tonight, has just been astonishing and incredible. And I want to particularly acknowledge Dr. Bassett, who is a second generation advocate for single payer, because her mother, Priscilla, has been a long time active member of the movement. I know people often ask what my plans for retirement are. You know, my wife and I, because of our work schedules, have never really been able to do a lot of traveling. We're now both going to be retired, and we are planning on doing quite a bit of traveling. Mary Bassett mentioned my calligraphy hobby. It's actually specifically Chinese calligraphy, and I will be spending every Friday in a pretty much day-long class on calligraphy, Chinese calligraphy, which I've been doing for 25 years. I will also be spending almost all day on Tuesdays in a Chinese watercolor painting class, also a hobby that I've pursued off and on for many years. But I certainly intend to keep up my advocacy for the New York Health Act. My colleagues in the legislature are going to continue to hear from me. And I may, from time to time, publish an op-ed piece. So yeah, I will continue to be part of this movement. And I just want to close, number one, by thanking all of you for your fantastic work. And second of all, by quoting Nelson Mandela's motto, which I often like to quote. I've even written it in Chinese. My teacher translated it. And that is, free yourself, free others, serve every day. Thank you.
Thank you so much, Assemblymember Gottfried. We cannot begin to express our gratitude to you, but luckily there is a chat where you can drop all of your well wishes for Assemblymember Gottfried in the chat. I am so grateful that you are having some fun plans for travel and enjoying your hobbies in retirement. And I am even more glad that you are joining the Campaign for New York Health as an advocate this time. As Assemblymember Gottfried just shared with us, we have come an incredibly long way in the fight for the New York Health Act, and everyone in this room and so many more contributed to that. And we are not there yet, and we have so much to do. And we have an incredible group of advocates and activists, which now includes Assemblymember Gottfried, or at least will in 3 weeks, that are going to get us there. And seeing all of your faces here tonight gives me the confidence and the drive that we are going to win the fight for health equity in New York State. Now, if you are just joining us or if you have newly joined us, please do introduce yourself in the chat, share your name, your pronouns, and where you are joining us from and your organizations. You can also share your wishes for Assemblymember Gottfried and congratulations and a celebration of him. We want to see where everybody that is joining us tonight is coming from, because the Campaign for New York Health is a statewide campaign, a statewide movement that includes nurses, doctors, med students, community organizations, businesses, individuals, those of us who are impacted by the health system, which is, of course, all of us, coming together united in a shared belief that we need a healthcare system that puts people first, and that healthcare system is the New York Health Act. And that's what we are fighting for today. The Campaign for New York Health was founded in 2014, which means that we are celebrating 8 years of working in coalition to pass the New York Health Act. We are marking 31 years of that bill being introduced in the New York State Assembly by Assemblymember Gottfried. And we are, with his retirement, at a turning point in the fight for guaranteed health care for all New Yorkers. We are coming up against some really major challenges right now, right? There is going to be a new sponsor in the Assembly, a new health chair in the Assembly after so many years of leadership from Assemblymember Dick Gottfried. We know that there are changes in leadership in the Assembly overall. That means that the bill is going to be reintroduced this year with new numbers. That means that there are new representatives that we will need to convince that this should be at the front of their priorities list, that they need to be a co-sponsor of this bill. And we, of course, need to get our current co-sponsors continued to be riled up for this fight, working to educate their constituents about the bill. We have partners across the state that we need to get on board in full support, from businesses to labor unions to community-based organizations, grassroots groups, and more. There is a lot to be done to get the New York Health Act passed, but we have already done so much, and the group that is here tonight, again, is an incredibly mighty, but just a small part of our movement. And it is our job tonight and every night to continue to activate that movement in order to pass the New York Health. Also, as you know, the Campaign for New York's Health itself is undergoing a change in leadership. The search for the new executive director of the Campaign for New York Health is well underway, even though it has taken a little longer than expected. And we hope to have someone in place by the end of the year. So lots of transitions coming up for January 2023. But I want us all to stay laser focused on where we are in this moment. We are continuing to face the challenges, the health impacts, and the heartbreak of the COVID-19 pandemic, other infectious outbreaks, and threats to public health. If we have not learned over the past few years that healthcare system that is driven by private insurance, that puts profit over people, that this system does not work, does not serve us, and as both Commissioner Bassett and Assemblymember Gottfried pointed out, does not even serve the financial and economic health of New York State and the New Yorkers that live in it. We know now more than ever that it is time to overhaul our healthcare system and to pass the New York Health Act. There is so much that is needed to grow the mass movement that we will need in order to not only pass the New York Health Act, but make sure that it is successfully implemented. And the thing is that every single one of you is part of that mass movement, has been building that mass movement. And I know together that is how we are going to pass the New York Health Act. So next up, we're going to hear from some of those grassroots organizational partners that have been working on the New York Health Act for so long. We want to hear about their plans for the new year, and how they are celebrating Assemblymember Gottfried and feeling fired up to pass the New York Health Act. First up, of course, we cannot have a celebration of our movement without highlighting the work of our nurses. The New York State Nurses Association is one of the co-founding organizations of the Campaign for New York Health. And we know that support from unions like NYSNA is essential to gaining the support that we need from the state legislature. And when healthcare workers speak up, particularly nurses who are routinely viewed as the most trusted profession, we know that people listen. We are grateful to follow the new leadership of the New York State Nurses Association and the nurses that are leading our movement. I am thrilled to introduce Marva Wade, another one of my healthcare heroes, a longtime nurse, avid single payer supporter, past president of the New York State Nurses Association and current chair of their single payer committee, who is also a board member of the New York Metro chapter of PNHP. Without further ado, Marva, please take it away.
Thank you so much, Carlin. It is an honor to be here tonight to celebrate Dick Gottfried. Many of you know that, as he stated, he was the whole issue of New York Health, the New York Health Act, and was brought to him partly by NYSNA, my organization. I wasn't there 31 years ago, but since I've been in the organization for about 40 years and a retiree myself, I certainly understand Dick wanting to retire. And as much as I appreciate that, it is really going to be a loss to all of us when he does do that. Everybody needs to have a life, and I wish that very much for him. But the New York Health Act has been on the NYSNA legislative agenda for all those years. It is one of the things that we have been fighting for a very long time. Many of you may remember Katie Robbins, who was the director of the campaign for New York Health with NYSNA. Katie and I went all over the place, putting out the word about the New York Health Act. And one of the things that all of you know is the fact that people don't really know what it is and how it would benefit them. So NYSNA, I have been with Dick in many meeting rooms. We have always gone to Lobby Day in Albany. I've been there to demonstrate. When you would go to Albany, there would be a sea of red and everybody knew that the nurses were in town. It was red everywhere. And everywhere that we went, we could always, we always knew that we would have Dick there, that he would have our backs. So it is with an honor and a privilege to have worked with him, to see his genius, to learn from him, and to know that we are in this fight, but we're going to win this fight. Education is the key, we believe. So those of us, I'm the chair of our single payer committee, and we put forward a resolution for the board of directors to establish a fund for our own campaign in the state of New York. We're going to have a statewide campaign to highlight the New York Health Act. So NYSNA has done many campaigns. They will do this one well. I am sure that they will. And look forward in your bus stops and your subways, everywhere, billboards, radio, TV, everywhere that you are going to see a notice that the New York Health Act is the way New Yorkers should be going. So I certainly celebrate Dick. It has been an honor and a pleasure to know him and to work with him. And it is my honor to introduce one of my comrades who've been in this fight with me for a very long time as the NYSNA board member, and now as the director of the New York State Nurses Association, Pat Kane, our director.
Good evening, everyone. It gives me such great pleasure to be with all of you tonight to celebrate a great champion for healthcare as a human right, and really a great friend to NYSNA. And I'm talking about Assemblymember Gottfried. In 52 years of public service, I can't think of any other legislator who's had a greater impact when it comes to improving the lives and health of so many New Yorkers with such compassion, integrity, and intelligence. And if that isn't enough of a legacy, all the folks that Dick has mentored throughout the years, including so many NYSNA nurses, sharing his knowledge and his faith in the process. And I have to say, we've had a really great run together working to guarantee quality health care to all New Yorkers. And Dick, we promise and pledge to continue your legacy. Just this October at our convention, our delegates passed a resolution to strengthen our resolve, to continue our work and commitment to the New York Health Act, and also voted to affiliate with National Nurses United so that we can build our power in our movement at the national level as well. So from the bottom of my heart, I'd like to say the nurses of NYSNA, thank you, and wish you all the best as you enjoy the next chapter.
Thank you so much to Marva and Pat for those wonderful wishes and send-off. We are so grateful to have you at the forefront of our movement. Next up, I'm thrilled to introduce Assemblymember-elect Sarahana Shrestha, who ran on a platform for the New York Health Act, ran an incredible race in the Hudson Valley, and we are so excited we'll be joining the fight for the New York Health Act and many other important causes in January. Assemblymember-elect, please take it away.
Thank you so much. Hello, everyone. My name is Sarahana, and we just got done talking to almost 16,000 people in Mid-Hudson Valley, and I can tell you with certainty that hardly anyone thinks that the current healthcare system is working. The workers don't think it's working. The people who need to get the healthcare don't think it's working. So I do very much wish that I was walking into a term where we were implementing the New York Health Act so that Assemblymember Gottfried could have a much more deserved retirement, even much more deserved retirement. But I will be one of those people who will be joining the Assembly to make sure that we continue the persistent fight for New York Health Act, because one thing that we know is that this is not something we are fighting for because it's easy. We're fighting for it because it's difficult and necessary. So we know what we're getting into. We know what kind of effort and persistent advocacy and follow-up and organizing it is going to take to win this. So I ran out of a sense of urgency, and my background is in climate organizing. And I just want to say, that as someone who is always thinking about climate change, healthcare is climate resiliency, because we cannot be naive about the fact that under climate change, people will probably get sicker. There will probably be new kinds of illnesses that we have to deal with, which means that we absolutely cannot walk into a situation where healthcare is tied to job, where healthcare is tied to marriage, where healthcare is tied to immigration status. It should be a basic right for everyone, for our own collective well-being and for our own sake. So, you know, we talked about earlier how the conversation for gay marriage has changed since it was first passed in New York. And I'm old enough to know, you know, to have heard at the time how impossible it was considered. So it is really important to hold our line on what we think is possible. And single payer healthcare is absolutely one of those things. If we want to talk about true safety, there's nothing that is more integral to safety than getting the healthcare that you need, than getting the medical attention that you need. So this is absolutely the New York that we're going to fight for. We had people who, even folks who did not know that New York Health Act existed, still you know, talk to us about how they think this is a nonsensical system that we are in right now, how healthcare is difficult for everyone. So I am very honored to be going into this term with very big shoes to fill in terms of advocating for the New York Health Act, but I will try to do my best. And I thank you so much for having me here.
Thank you so much, Sarahana. We have some. Thank you so much, Sarahana. We have some incredible energy that is coming into the legislature, and we are so excited to fight together to pass the New York Health Act. Next up, I would like to introduce Anna Koerner from the PNHP New York Metro and Students for a National Health Program Fellow. Please take it away, Anna.
Hi, everyone. It's so great to see so many faces here. My name is Anna. I'm a third-year medical student at Columbia, and I am one of the 2 PNHP student fellows. The other is Samia, and she's a third-year medical student at Stony Brook. And I'm here to talk to you specifically about this new legislative advocacy fellowship that PNHP is piloting this year. It's called the Universal Healthcare Legislative Advocacy Fellowship, or ULAF for short. And it's an 8-month fellowship that's centered on developing legislative advocacy skills, and it's directed towards healthcare professionals and students who are interested in participating in advocacy and activism in general, but with a specific focus on developing skills useful for PNHP's Lobby Day, advocating for the New York Health Act in the spring, as well as carrying those skills forward into whatever future endeavors that those people may choose to pursue. And so we have about 28, 30 participants, a wide variety of backgrounds, lots of medical students, public health students, social workers, nurses, residents attending. So it's a very broad and multidisciplinary cohort. And the format of the fellowship is they have monthly didactic sessions that they attend with a sort of associated homework assignment that helps to develop those skills and directly apply them in preparation for Lobby Day going forward. We have the fellows working with each other and partners and assigned to certain districts based on where they live or have interests in, and they carry out research on these state senators in the hopes of like planning and facilitating Lobby Day visits with them. So for example, our first session was an overall introduction to the New York Health Act and how to research a district. And so we gave them their assignments and they went off and they researched the demographics of their district, local organizations, basic legislator information. The second session was an overview of how a bill is even passed in New York. And so following that, they continued to delve into more research surrounding their district. And then during the third session, it was a great workshop on facilitation skills. And so now they're researching different organizations and groups that they might connect with to help and provide representation at these Lobby Day visits. And future sessions will be focused on power mapping, storytelling, social media, relational organizing and base building. And so we're really excited about this fellowship. People have been enjoying it so far, and we're excited to see how it turns out. And yeah, that's all I had to say on it. And it's great to see everyone here again.
Thank you so much, Anna. Next up, we are going to hear from Brendan Whitelaw from Metro Justice. Thanks for joining us, Brendan.
Hello, everybody. So my name is Brendan. I'm calling in from Rochester, and today I'm speaking on behalf of Metro Justice and then the Rochester chapter of the Campaign for New York Health. And so first, I want to congratulate and thank Assemblymember Gottfried for his service. His vision for a better healthcare system in the form of the New York Health Act is actually what inspired me to become an activist. I had never been involved in activism prior to joining this group. And the bill and the campaign has really showed me that things can be a lot better than they are, and which is kind of why I continue to work in this group. So the Rochester campaign and Metro Justice, we're committed to continue to grow the grassroots support for the bill in the Rochester area. So this upcoming year, we're going to be knocking on doors, making phone calls, getting out on the streets, getting to the public market, and really getting the word out about the New York Health Act to build support. The other thing we'll be doing is continuing to engage with the key stakeholders, but in the Rochester area, it's including unions and small businesses. And then we're also trying to broaden our outreach beyond just the city to more rural regions. So that'll be in process. And as many of you know, over the past few years, we've expanded our Democratic representation in the New York legislature, and Rochester. We're really proud to have 4 Assembly members, Damon Meeks, Sarah Clark, Jen Lunsford, and Harry Bronson, as well as 2 senators, Samra Brook and Jeremy Cooney, all of which sort of represent the Rochester area and are all supportive and co-sponsors of the New York Health Act. So we're happy to be able to work hand in hand with them to further build support. So on a larger level, as we continue to go forward, we're really excited to work with statewide and the other chapters across the state to build this movement. So thank you, Assemblymember Gottfried, for leading the charge. And on a more personal level, thank you for inspiring me to get involved as an advocate.
Thank you so much, Brendan. It is incredible to have people from all over New York State here tonight and doing incredible work in their communities to pass the New York Health Act. Up next, we have Julie Schwartzberg from CROC, the Cross Union Organizing Committee, to speak to us.
Hi, good evening, everyone. I am so honored to be here among all these wonderful fighters, and thank you, Assemblymember Gottfried. We have a little fight going on here in New York City, which I'm a retiree. I'm a member of an organization that was formed when we found out that the city of New York was trying to privatize our wonderful retiree benefits. So we have active, strong union members from District Council 37, from the United Federation of Teachers, from the Council of School Supervisors, from the Professional Staff Congress, et cetera, saying that we don't want our wonderful, wonderful healthcare to be privatized. This is not just New York, it's going on all over the country. So far, we've been fairly successful in stopping this. But the main point I want to make is that we know that everyone should have the wonderful benefits that we have, that nobody's healthcare should be privatized. And that when we win this one, hopefully, we will try to make sure that everyone in the state of New York has good health care, work for single payer, and follow in the footsteps. I'm sorry, Assemblymember Gottfried, we have never met, but I'm gonna follow in your footsteps. So thank you very much. And we are going to work very hard for all our unions, because we are union activists, to get them to see that everybody in New York State needs good health care. So thank you.
Thank you so much, Julie, for the incredible work that you and the others at CROC are doing. It is absolutely critical to passing the New York Health Act. Up next, we have Jeff Mikkelson from NYPAN, the New York Progressive Action Network, and longtime New York Health Act activist.
Thank you, Carlin. And first of all, thank you to my former Assemblyman, Dick Gottfried, for your decades of heroic service and leadership. And I'm here tonight. By the way, I wish you a rewarding, satisfying, and well-deserved retirement. I'm here tonight to talk not just about what NYPAN is doing on the New York Health Act, but what organizations around the state or individuals can be doing over the coming months to work on this bill. As Carlin pointed out earlier, there are still a lot of uncertainties right now. We don't know who the lead sponsor of the bill is going to be in the Assembly. We don't know who the executive director of Campaign for New York Health is going to be. But in the meantime, the work goes on. And there's a lot that we can be doing and a lot that organizations are doing. So I want to highlight a few of those. And these are things that NYPAN and other groups are doing. So by the way, the NYPAN is the New York Progressive Action Network. It is a group of grassroots organizations around the state of New York working to pass progressive legislation and elect progressive leaders. And I also facilitate a coalition of grassroots groups here in the Hudson Valley, where I live now, working to pass the New York Health Act called Hudson Valley Demands New York Health. And the first thing that I would say about continuing the work is that if you're not already part of an organization like NYPAN, like DSA, for example, PNHP, some of the other organizations, Metro Justice that have been working tonight, that's the first and best thing that you can do. Join and get involved with an organization that's already doing this work. There are lots of them, and whatever your speed is, whatever area you live in, there is work to do, and there are people who you can plug in with immediately. So that's my first, action to highlight. The second would be that you could organize a canvas or a tabling event. That's something you could do as an individual, as a group. There are groups around the state. I know a couple of NYPAN groups, Grassroots Action New York and the Bronx chapter of NYPAN, are planning to do them weekly. The campaign does have a toolkit for putting together a tabling event, and I'm going to later put a link in the chat to that. So that's another great thing that you can be doing. A big barrier to passing this bill is that not enough people know about it. And going out and talking to folks wherever they are, farmers markets, healthcare events, you name it. These are great places to set up a table and introduce the bill to people. You can also host a phone bank. If you don't, it's kind of cold right now. If you don't want to be outside handing out flyers and whatnot, you could organize a phone bank, call people in their homes, introduce them to the bill, and try to get them involved in the campaign. Another thing you could do is host a public education event. The campaign has tons of great speakers. You've heard from some of them tonight who are willing and able to join your event to introduce the New York Health Act to people, and all different sorts of groups and organizations can profit from this. I've spoken to business groups, I've spoken to grassroots groups, you name it. It's a bill that just needs better exposure, and I think once people know about it, they tend to support it, because the system we have now is insane, and as soon as they learn that there's something better out there, they tend to really get behind the bill. Another thing that you could do is work on passing a local resolution. I think we're up to about 22 around the state of New York, including New York City, that have passed a resolution in support of the New York Health Act, but we can always use more. I mean, it's a great thing to organize around and, introduce the bill to more people with, but it's also a great way to get local municipalities, counties, and so on record in support of the bill. That really does influence legislators in Albany in their thinking about whether to pass the bill or not. And finally, I would say that you can, you can join what a lot of other people have been doing that we've spoken about tonight, which is to lobby your representatives. Reach out to them, bug them often, even if they say they're already a supporter of the bill. You can call them, you can email them, but if you're really ambitious, you can set up a lobby meeting with them. And the campaign also has a toolkit for that. Then I'll put a link for that in the chat. So stay involved. We're going to win this thing. You know, Dick has taken us so far. We're like this close to the finish line. We need to get it past that finish line, and you all are going to be part of that. So thank you.
Thank you so much, Jeff. We are here to celebrate Assemblymember Gottfried. We are here to celebrate our wins with the Campaign for New York Health. We are here to get energized about the fight ahead. And as Jeff so wonderfully shared with us, we are here to take action, because this is a movement that is full of action. And we know that every one of our actions is how we are going to win this. So we'd like to hear from all of you. How are you going to participate in organizing for the New York Health Act this year? What are you interested in doing to help move the New York Health Act forward and build for universal guaranteed healthcare for all New Yorkers? A poll has just popped up, and we would like to hear from you how you want to participate. Feel free to vote in that poll so we can learn more about how you'd like to get involved and how the Campaign for New York Health can support you to bring the New York Health Act to your neighbors, your friends, your communities, the local organizations where you live, your elected officials, and more. We know that it is going to take all of us to win this fight, that we all must continue pushing, even when the weather is cold, even when the legislature is not in session. This is a fight for our lives, and it is a fight that is year round. Wow, I'm seeing some incredible commitments from folks to share their healthcare story, to write an op-ed or letter to the editor. Lots of folks that want to join legislative visits. Lots of folks want a table that's essential to getting new supporters. Lots of folks to join the union member outreach team. Thank you so much, everyone. I am so grateful to see the energy, even if we're not in the same room. I can feel it reverberating through the internet, and really grateful for all the work y'all are doing. Now we have a couple of things that y'all can join coming up pretty quickly. So if you are going to be doing any sort of holiday events or upcoming community fairs, anything like that, we do have a tabling toolkit that you can use, and we will drop that link in the chat. Thank you so much, Mandy, for sharing that with us. This makes it easy for you to make New York Health Act outreach a part of whatever holiday events you're having, whatever community organization, fairs or anything like that you're doing. It is a great way to get more people to know about the New York Health Act. Some of our most active activists came to the New York Health Act through tabling, so we know that that is critical to growing our movement. We also have an event coming up on Tuesday, December 20th. So next week, if you're feeling fired up and ready to do something about the New York Health Act, our partners at the Northwest Bronx Community Clergy Coalition, one of our steering committee members, is doing an event with NYSNA, the New York State Nurses Association, on health justice and equity in the Bronx. So you can sign up for that. Hopefully we can drop the link for that in the chat as well. And so that is, again, Tuesday, December 20th, and coming up, a way for you to get involved. And wait, there is more. We have our PNHP, Physicians for a National Health Program, Lobby Day coming up. And that is a critical day to bring our energy to our legislators directly about the New York Health Act and keep up the fight, make sure that they know that we are continuing to push for this. So you can sign up for that. We'll drop the link in the chat as well. One of hopefully many lobby days for the New York Health Act that'll happen this year. Again, a critical way to bring your stories and your experiences directly to our legislators and keep up the pressure for the New York Health Act. And speaking of bringing our stories together, we also want your healthcare stories. We know that data is important. There is a financial reason to pass the New York Health Act, right? We have data that shows us that our healthcare system is currently too expensive and doesn't provide enough care. We have data that shows us that most of us, in fact, 50% of us are not getting the coverage we need and are often skipping needed appointments and treatments because of our lack of good healthcare. But at the end of the day, we know that it is our stories that are going to win guaranteed healthcare for all New Yorkers. So please share your story with us. That way we can make sure that there are stories in every single district across New York State. That's a great way to get your neighbors and your friends involved, because we all have a healthcare story, and that is how we are going to win this fight. And then, of course, last but certainly not least, please donate. If you are doing any sort of end of year donations, it is critically important that you donate to the Campaign for New York Health, because we know that we are up against forces that have a lot of money. We are up against private insurance and big pharma, and they have money, but guess what? We have the people. And even if we do not each have a lot of money, together we can raise enough money to power this campaign to the finish. So whatever you have, whether it is 10 cents, whether it is $100, please consider donating to the Campaign for New York Health. If you are looking for a holiday gift for someone, donate in their honor. There are so many ways to contribute and make sure that we can start the Campaign for New York Health off on a strong note next year. So many ways to get involved. We hope you pick one or multiple of them so we can continue the energy and continue the fight, start off 2023 pushing for guaranteed healthcare for all New Yorkers. But in the meanwhile, let's spend a little time together, because y'all have been hearing way too much from me. You've been hearing from our absolutely incredible speakers. Now we want to get a chance for everybody to talk to each other and hear about what's going on with you, what you're excited about for the New York Health Act in 2023. Maybe you have some questions you want to share with the group. So for the next approximately 20 minutes, we will have Zoom breakout rooms available for our holiday party. Of course, we can't, do this in person, but this is our closest approximation. So head to your breakout room of choice to spend some time chatting with your fellow healthcare activists, and we'll see you there. Welcome back, everyone. Welcome back. We'll give a few moments for everyone to join back in the main room before we wrap up our evening together. Hopefully everybody had a fantastic chat with some of your fellow healthcare activists. I know that I loved hearing about political gossip and what's coming up with the political landscape in my very active breakout room. Let's see, do we have everyone back? Or are we still waiting on folks to return, I think?
I think they're back.
All right, okay. Everyone is back. Lovely. Look at all these incredible faces. So thank you for joining our event tonight, for your incredible advocacy and activism for the New York Health Act. Thank you so much to the Campaign for New York Health and to our steering committee members, all of the organizations that you see here today, for leading the charge. And thank you to our incredible speaker tonight. And last but not least, thank you to Assemblymember Dick Gottfried for your leadership and for inspiring us all. The energy in this virtual space tonight was incredible and reminds me of why we're going to win this fight, because we have come so far in building movement for something that as Assemblymember Gottfried said, 30 plus years ago was never heard of in New York State. And now the New York Health Act has become a central issue in the fight for justice for New Yorkers. And each and every one of you is a incredibly important part of that. And we are only going to continue to grow this movement, to grow our power, and to grow our commitments to the fight for universal guaranteed healthcare for all New Yorkers. So thank you for everything you do. Stay involved. Again, we're going to follow up with all of these resources for how you can continue to fight for the New York Health Act and how you can continue to participate in 2023 as we continue pushing for healthcare for all New Yorkers. Please don't forget to donate to the Campaign for New York Health if you are able. The link is in the chat. And again, as we send you off to your nights, thank you We are going to close with a chant and with a song. Now, stick with me as we try to do this. This is our motto, and I believe in us. So if everybody will come off mute and join me in a rousing chorus of everybody in, nobody out. I see people unmuting themselves on the count of 3. Everybody in.
Nobody out.
Everybody in.
Nobody out.
I like the everybody in.
I like nobody out.
Amazing, amazing, amazing. Now just imagine that reverberating across all of New York. Remind yourselves of what we are fighting for and the incredible people that are in this room with you and are in this fight with you. And we have a beautiful song to share with you as we see ourselves out for the night. Again, thank you all and good night.
Wait, what song is it?
Good night.
COVID virus made us ill. Got no money for the doctor's bill. Keep your eyes on the prize. Hold on.